Thank you very much indeed, and thank you for inviting us to talk to you today. God, you've had a long day, haven't you? I've just been thinking about my granddaughter, Maisie, our oldest granddaughter, who's got one GCSE paper still to sit tomorrow morning, and then she's free for the summer. And at least your last paper today is not on physics. Yeah. I want to begin by asking you what motivates you to do what you do? What fundamentally motivates you? I was staying with my daughter Rosie the other week, and she has two children, Nina aged 4 and Josh aged 2. And Josh was sitting on Rosie's lap, and Nina started coming and pushing in. "It's not fair," says Josh. And Rosie was really quite surprised, not because her children were fighting for her attention. I think I think that was a familiar situation. But that Josh put it in terms of fairness. She was surprised he even, knew the phrase, had the concept. But I think that the concept of fairness, of justice, of fairness, is something that's with us as a very profound instinct from very early in our lives. Certainly that's true for me. And I guess another similar kind of instinct is the instinct to protect other people, particularly children, maybe. And often when we're feeling these motivations in relation to other people's children, the urge to protect, the urge for fairness, to treat people fairly, I think we may actually be trying to resolve something about our own childhoods, our feelings that we were treated unfairly, or that we needed protection and didn't get it. So this sense of fairness, I'm quite sure, is something that's been with me all my life and drives the work that we've been doing. So Will and I are going to be talking about a large research project on children's services in the UK, especially in England. Family support and child protection, I'm sure you probably know, in the UK are integrated in single service, usually run by local authorities or by health and social care boards in Northern Ireland. But the children's services are devolved in the 4 UK countries. Different laws, different structures, different funding, different policies to some extent. So they create the opportunity from a research point of view for a kind of natural experiment about how things are being done differently and what the consequences are for children. And the Child Welfare Inequalities project focuses on children's social care as a site of social inequality. And we're going to talk about that, and we're going to encourage you to think about your own working situations through an inequalities lens. In England, especially in England, we see a growing gap between the good intentions of the vast majority of people working in child welfare services, their good intentions, and the ways in which children and families are being treated by a system that's increasingly dominated with a concern to identify children at risk. And the conceptualization of risk is a narrow one. It doesn't include children who are in families that are destitute, doesn't include the concept of homelessness in the concept of risk. And there's a growing vicious circle between this narrow conception of risk and the focus on it, and the dismantling of services to support families to stay together, whether that's Sure Start children's centres, refuges for women fleeing violence, mental health provision, legal advocacy, income rights services. And in much of the UK, this has broken families' trust in the state's obligation to support families, which the government actually signs up to in the Convention on the Rights of the Child. And crucially, as we see it, the consequences of this imbalance between support and identification of risk are unequally, unfairly distributed between children and between families. The less well off and the less powerful you are, the more likely you are to find children's services knocking your door, and the less likely you are to have the range of resources that help you keep your family together and to parent successfully. In the week when I was beginning to write this, there was news in England about the increasing numbers of young people leaving care at 16 or 17 and being placed in unregulated accommodation, making them prey to sexual and criminal exploitation. We must know by now that the history of good intentions don't necessarily bring good outcomes. I don't need to tell you in Ireland about the at times dreadful history of childcare services, not only here, but around the world. And in England, we need to rebalance the impact of the system from investigate and remove to support and fairness. And that's what motivates us to focus on inequalities in child welfare. In the same week, a Human Rights Watch report showed not only the extent of hunger in the UK, but also how austerity cuts have hit children and families the hardest, harder than any other branch of government. And this has been accompanied, particularly since 2010, with a harsh blaming narrative about families who are in difficulty, families that are struggling, despite the fact that 2/3 of all families in poverty now include someone in work. And for me, for us, inequalities in child welfare are one of the sharpest markers of this harsh environment for families. So what do I mean by inequalities in child welfare? It's a long and slightly convoluted definition there, but it focuses on three key things. Inequalities in children's chances of being on the receiving end of children's services, i.e. inequalities in difficulties in childhood, severe difficulties in childhoods. Inequalities in how services treat people and how services are distributed. And the consequential inequalities in outcomes in children's lives, both in childhood and in later life. And for these to be inequalities rather than just variations or differences, they have to reflect social structures. They're not just random. And to be unjust, they have to be avoidable. What does this look like in children's lives? In Blackpool, today, something like 1 child in 50 is in out-of-home care, 1 child in every 2 children's school classes. In Richmond-on-Thames, at the opposite end of England, it's something like 1 child in 400, 1 child in a school, 1 child in a junior school, not 1 child in 2 classes. 8 times, you're 8 times less likely to be in care in Richmond than you are in Blackpool. Where would you rather be a parent? For decades, we've been thinking about inequalities in health and the gap in educational attainment, but we haven't had a discourse of inequality in the child welfare field, and it's time that we did. And so our researchers set out to answer some very basic questions about inequalities in child welfare. Firstly, just how big are they? How big are the inequalities in children's chances of a welfare intervention? And what are the key factors that lie behind those inequalities? What are the drivers? What are the causes? In our research, we've used 2 key measures. So that's the proportion of children who were on child protection plans or child protection registers in the different countries, or the proportion of children who are looked after in out-of-home care, particularly children in foster and residential care, because that's a measure that you can compare pretty equally across countries. Once you get into kinship care, how that's defined and recorded is very different in different countries. So those are the key measures that we've used. And have I gone? Yeah. And sorry, just a moment. I've got the slides in the wrong order. Just bear with me. And our model for how these inequalities work is in terms of a product of demand factors and supply factors. So demand factors are those factors in children's and families' lives which increase or reduce their chances of being involved with children's services. So that's something about the condition, their family circumstances, something about the neighbourhoods that they're in, something about the communities that they're a part of. Supply factors are to do with the patterns and priorities of the services that are delivered or are available to them. So if you think about education, how well children do at school is obviously partly to do with their biological inheritance, but it's also about, on the one hand, the advantages or disadvantages they bring from their home lives, and on the other hand, the quality of the education that they're receiving. It's the same thing, demand and supply, the circumstances of childhoods and the services that people are offered. It's the same thing for child welfare. And it brings us to this rather sharp and difficult question. Do inequalities in the patterns of child welfare interventions simply mirror social inequalities generally? Or are there factors in the way in which services are resourced, focused and delivered which contribute to inequalities? Do we make inequalities better or worse or unchanged? That's the third challenging question. Just before you try and take in that slide, I'm going to talk mainly about small bits of our very briefly about the quantitative data that we've got on thousands of children across the 4 UK countries, particularly focusing on those 2 measures that I've talked about, children on child protection plans or registers, or children in foster and residential care. And then Will's going to look behind the statistics at mainly the qualitative or mixed method studies of frontline practice. We're not really going to go into the methodology today. We've written lots of publications about this, and you can go on our website. You can Google us. There's lots of places where you can read up more of the details. So here's the first slide. And this shows all the children divided into 10 deciles, from decile 1, which are the most advantaged, 10% of families in the country, to decile 10, which are the most disadvantaged, 10% of families in the country. And the proportion of children per 10,000 in each of those groups, each of those deciles, who are either on child protection plans or who are looked after in 2015. And the key thing for me in this slide that I want to point up is that these inequalities are very large. You're more than 10 times more likely to be in care on a child protection plan in the most disadvantaged 10% of families than in the least disadvantaged. Not 10% more, 10 times more. And the largest causal factor of a children's chance of being in care, a child's chance of being in care, is family resources, family material, and social circumstances. In England, there's been a tendency for policymakers and politicians to say that poverty doesn't really matter in how children look after their children. Despite all the evidence about the explosion of food banks, about children going to school hungry, about homelessness, about asylum seekers without access to public funds, about benefits cuts, errors in calculations and sanctions leaving people without any money, the public position of child protection policy in England from 2010 onwards has been to suggest that poverty wasn't really an issue in child protection. It isn't true. And the difficult message, which will spell out, is that social work practice in England has largely ignored the role of material resources in working with families. So you've got the public position, but it's actually mirrored in the practice that we've observed as well. The second key message is that this is a social gradient. It looks like the same graph, doesn't it? It is the same chart. But the message is here now that this is a social gradient. It's not that everybody's fine until you get into poverty and then it falls off a cliff. Each step increase in family resources means your children are less likely to be in care or on a child protection plan. If it was just about poverty, maybe you could argue that there's something about poor people, which means that they're also poor parents. But look what this says. There's a difference in the proportion of children in out-of-home care between the fabulously wealthy and the very wealthy. Right across the board, how well off you are, the resources you can command, the power that you have, affect the chances of your children being separated from you. And it raises the question about whether services are distributed in ways that might reduce these inequalities. I haven't got time to go into ethnicity properly, but it's the second largest factor after family resources in determining children's chances of being in care on a child protection plan. It's a complicated picture, but if you look at the column 5, this is now divided into 20%, not 10%. You can see that there's huge differences in children's chances of of being looked after between Asian groups, which are much lower than white groups, and in that quintile, white rates higher than black rates. But because so many black children, 50% of black children in England live in the most disadvantaged 20% of neighbourhoods, the overall rate for black children is higher than for white. This is a profoundly complex pattern. You have to look at the interaction of poverty, family circumstances, and ethnicity. And the tragedy here, really, is that this is simply not being addressed in policy or practice. So most government reports on the child welfare system, certainly for the last 10 years, don't mention or scarcely mention issues of ethnicity. And actually the research community hasn't done much better either. So that's something about the demand side. But on the supply side, funding also has a significant effect on intervention rates. This divides local authorities in our sample between those with low average deprivation and high average deprivation. So if you look at the right-hand column, the overall picture for low deprivation local authorities is that they have a smaller proportion of children looked after than the local authorities with high deprivation, 40 per 10,000 versus 73 per 10,000. Okay, that's exactly what you'd expect. Lower deprivation, fewer children in care. But if you look at each of the quintiles, so if you compare families in similar circumstances, in low deprivation and high deprivation local authorities, that picture's reversed. And it's the low deprivation authorities that are intervening more in family life. Why would that be? Apparently paradoxical finding. Our evidence is that it's not really just about different patterns of practice. It's fundamentally driven by funding levels. The low deprivation authorities, I'm not saying they have enough money or that they're well off, anything like that, but relative to the needs that they face, they have a bit more money than the high deprivation local authorities. And that gets played out not in better prevention, not in keeping families together, but in removing more children. And that's another profoundly difficult message from our evidence. And then finally, in terms of our 5 key findings that I'm talking about, there are big inter-country differences. when we compared the 4 countries, it wasn't the most deprived country that had the highest rates. Northern Ireland has higher levels of deprivation for children than the other 3 UK countries. But it had the lowest proportion of children in foster residential care. And it had the least steep social gradient as well. Will's going to say a bit more about that in a minute, but what this illustrates is not that family deprivation and family circumstances don't matter. In every country, there was a social gradient that I've been talking about. But rather that services, priorities and policies and practices matter as well. So again, it's the interaction of factors that we have to think about: demand and supply, family circumstances and policies and funding. So I think that suggests that these patterns aren't just beyond control, as it often feels to us, I think, but that policy and attitudes and practice make a real difference to what happens to children. So what are the take-home messages? Firstly, this isn't just because I want you to read my work. Please read the detail. I've had to talk terribly briefly about this. It's complex and tricky stuff, and we have written lots of stuff about it, and I've had to oversimplify today. Please read more about it. Second thing is, as I've said, these inequalities are very large, and I think it's absolutely appropriate that we think about them as inequalities that we in the field are involved with. This is just as unfair as inequalities in health and education. They reflect a social gradient, not a divide between parents and poverty and everyone else. If you don't have enough money, you can't provide for your children as well as you'd like, and it causes you huge amounts of stress and feelings of shame. If you have a good deal of money, not only are your worries less on the whole and your status higher, you can buy support and opportunities for your children. Parents in poverty are not different kinds of people. They're facing greater challenges with fewer resources for problem solving. The intersection of ethnicity and family resources is the second major factor, and it's very poorly understood or addressed. And finally, it's not only how well services are funded, but what services do with the money that's crucial. More funding alone, without a change in priorities, may result in more families being separated, more children being taken into care, as in the low deprivation local authorities in England. So we think our evidence supports the case for rebalancing services towards an explicit focus on reducing inequalities. That should be a key policy goal. A focus on reducing inequalities in children's lives by supporting families better. And finally, what does this mean in your working context? I've been talking mainly about England in the main and the UK. So where you're working, do you know whether the services you're involved with are reflecting, reducing, or reinforcing inequalities? Are you collecting the data you need to be able to answer that question? Are you offering the right services in the right places with the right outcomes to be part of a movement to increase equity for children? Would you recommend a friend or a relative in trouble to ask for your services' help? Thank you. Now I'm going to hand over to Will.
So Paul's introduced stark inequalities in child welfare, 10 times more likely to be on a child protection plan or looked after if you're living in the most deprived 10% of neighbourhoods in England. We conducted 8 case studies to try to understand this in some more qualitative depth at the level of practice. So we have these overarching statistics, these patterns, which Paul's just introduced to the room. What we wanted to know is what this means at the level of social work practice. So how are social workers making these crucial decisions, these important decisions about families? What's the interplay between decisions to intervene in families' lives and their social and economic circumstances? And how do we make sense of this? Can we make sense of this by seeing what social workers do, by observing their practice, by speaking to them, by asking questions? So 4 of these case studies took place in England, 2 of them took place in Scotland, and more recently, 2 of them took place in Northern Ireland. And what I'm going to do quite briefly is walk you through just a few of the headline messages, some of the key findings from these case studies. I'm going to talk about England and Scotland first, and then I'm going to talk about Northern Ireland. The reason for that is partly because England and Scotland came first, and secondly because, contrary to what we might have expected, based on the fact that these services are devolved and different, the findings across the English and Scottish case studies were strikingly similar. So we can, crudely, talk about them together. Poor localities are the usual sites of social work practice, and this was an accepted norm. Within our case studies, we focused specifically on key areas, neighbourhoods, if you like, that were comparable in terms of the level of deprivation. So across the local authorities that accommodated our work, we'd identified sites that we would talk to social workers about, and these sites were areas of quite concentrated deprivation. None of our respondents were surprised at the sites that we had chosen to focus on. There was a sense that these were the normal places where social work happened. There was a sense that poverty had become like the backdrop for social work practice. It was just the status quo, right? And in that respect, it was something that social workers rarely reflected upon critically, at least in our conversations. It was seen as something that was unremarkable, so it wasn't remarked upon, like the wallpaper of practice. The scale and complexity of unmet need that social workers commented on, and particularly for England and Scotland, the hollowing out of family support services was common across all of our case studies. Austerity is biting. It's having really significant impacts for the availability of early help and family support services. What social workers are able to work with and offer to families, the preventative services that are there to support families, are being eroded. They're being eroded significantly in England and Scotland, and this was a really strong narrative in the conversations that we had with social workers. Poverty is ingrained and endemic, but it's not always visible in practice responses. And though there were some differences, this was surprisingly consistent across the sites. When we sat down with social workers, right, when we had focus groups together and there was time for us to have reflexive conversations about practice, social workers said profoundly detailed things about family poverty, about the experience of poverty, about its relationship to parenting, to family practices. But this time within social work wasn't a reflection of what the daily practice of social work feels like when you're busy, when you've got a high caseload, when you're doing lots and lots of administrative work. So that understanding that social workers were able to articulate when we had conversations weren't always filtering down and evident in the practice that was observed in some of the case files that we looked at. So social workers know about poverty, but they're not always able to apply that knowledge in the way that they might choose to or aspire to. Some social workers said that they didn't see anti-poverty activity as core business. They said that actually what they needed to do was focus on risk and issues of deprivation, of warmth, of shelter, of food, weren't the bread and butter of what social workers needed to do. This is what Shane Butler, in the talk just before, might have theorised as role adequacy and role support issues. Role adequacy in terms of social workers saying, do you know what, poverty is too big to tackle for us. How do we do this? It's a systemic issue. We're in poverty. Some social workers said, how can I address poverty when we're in poverty? My wheelie chair's knackered. We've got no money for our resources, we're working overtime. How can we address a structural issue like poverty when we're experiencing time poverty, system poverty, service poverty? And issues of role support. So some social workers said, and you can see this in the quote on the board, that they were actively discouraged by managers from doing some of this anti-poverty work and this advocacy work with families. Social workers talked about the risk of drowning if they were to take this kind of work on. Sinking and drowning were words that social workers used quite often to describe the sort of the everyday experience of child protection. One social worker described a scene after a team meeting at the start of the day when social workers had taken about an hour out of their daily practice and then walked back into the office as a crescendo of madness because people were trying to catch up on the hour that was missed. Phones were ringing, social workers were rushing out on visits, a crescendo of madness. So really high intensity work and work rates, which meant that this slower, detailed advocacy work was much more difficult for social workers to accommodate and to do with families. And at times, practice narratives could reflect a focus on personal responsibility over and above structural constraints. So where this kind of emphasis on structural inequality might come through in the focus group discussions, it wasn't always there in the way that social workers talked about their cases, and it wasn't always there in our observations of practice. One independent reviewing officer said, you can give these families £1 million and they'll still have the same issues. They'll still be in the child protection system. It's got nothing to do with deprivation. Poverty is the outcome and not the cause. And there were instances observed in various different local authorities where social work practice could unintentionally embed the shame and the stigma of poverty for families. But I want to just make a crucial point here, and this is a really, really important point. And that's that fundamentally it was the systemic constraints within which social workers practiced that frustrated their attempts to support families in the way that they aspired to do so. Social workers don't get into social work because they want to be punitive, right? I didn't speak to any social workers in any of the 6 case studies that said this is why I do social work. My calling is punitive practice. Social workers want to help families. And I met lots of social workers who were deeply frustrated and troubled by the extent to which the systemic constraints within which they were practicing made it harder for them to do what they felt social work ought to be doing with families. So I think that that's a really important point. And if you're going to take a picture of a slide, I think that's the slide that I'd like you to take a picture of. So Northern Ireland's interesting to us, and that's because in terms of our quantitative data, it's a little bit of an outlier. Northern Ireland has higher levels of deprivation than the other UK nations. It has higher levels of deprivation than England, Scotland and Wales. And according to the data that Paul had presented, we would assume that higher levels of deprivation equate to higher levels of child welfare interventions, more child protection plans, more children on the looked after child register. But that is in fact not the case with Northern Ireland. So in Northern Ireland there are actually lower proportions of children on the child protection register and lower rates of children looked after despite having higher levels of deprivation overall. There's also of course a history of tensions and conflicts between communities, troubles. There's high proportions of children living in the poorest areas. There's lower levels of ethnic density and lower levels of ethnic diversity, and there's a different organisation and structure for social services and children's services. So it's an interesting case study, and what we did after these English and Scottish studies is we did some follow-up work in Northern Ireland. We replicated the method to explore these differences to see if we could make any sense of why, despite higher levels of deprivation, we've got lower levels of intervention. So I'm just going to walk you through some of the differences that we observed between practice in Northern Ireland and England and Scotland. The first point is that there was evidence of a higher routine awareness of poverty and deprivation in general practice discussions. Outside of the focus group context, social workers in the Northern Irish case studies, 2 different health and social care trusts, were much more likely to talk openly about poverty as sort of significant and important for social work, as core business for social work, and as crucial for families' experiences and capacities to parent. More of the social workers that we spoke to in Northern Ireland were from the areas where they practiced, had grown up in those communities, and were embedded in terms of where their offices were located, near the communities in which they were working. There seems to be a tendency in England and Scotland to be moving social work buildings to the outskirts of local authorities, which means that social workers are quite often travelling using sat-navs to get to where it is they practice, these areas of deprivation, and it makes it much more difficult for social workers to really understand the communities in which they're working, to know where the different supports are that still exist, to know the dynamics between families in the communities. And this seemed a little bit different in the Northern Irish case studies, which was interesting. There were routine references to extended family and community capacities to care for children, and this is played out in higher rates of kinship care in Northern Ireland. So Northern Ireland has much higher rates of kinship care compared to England and Scotland. And social workers talked about family differently, talked about family culture in a different way, in a less pejorative sense, and about family support. And this was particularly the case in the most deprived parts of the case study sites. So, in contrast to the English and Scottish data, the social workers in Northern Ireland talked about the most deprived areas as places that had quite strong communities. In England and Scotland, those same areas would be talked about in terms of deficit, in terms of an absence and a lack of community. The history and role of communities then was recognised and discussed, and there was evidence within that of a greater awareness of and access to community support services. Social workers seemed to know more about which services were available, and actually there was, although it's not problem-free, there was less of a narrative about cuts to services. Although this was actually uneven and mixed across the trusts. So we observed that some trusts were perhaps faring better than others. None of our sites were adequately resourced, and I want to be clear about that. Everybody felt that they were under-resourced. But if you compare the narratives from the Northern Irish sites to some of the English and Scottish sites, and factor in perhaps some of the delayed implications of welfare reforms, you've got a slightly different picture here. And then care and protection plans revealed some evidence, although again this was uneven, of children and families' socioeconomic circumstances being addressed. So there was more evidence of that understanding that you can elicit when you talk to social workers about poverty, actually filtering down into evidence of social work practice, which was encouraging to see. So these are some quite interesting differences between the practice observed in Northern Ireland and the practice observed in England and Scotland. There are also similarities, particularly in terms of discussion around the inadequacy of resourcing, around unmet need, around the need for more services, basically, for families, more preventative work. So I want to finish on a few concluding reflections. The first is that social workers often have deep knowledge about poverty and its consequences, and this is important. But they are rarely given adequate resources to engage with this. The second is that there's a continued need to reconnect with the core business for families: food, shelter, warmth, dignity. But the priorities of systems can get in the way of this. Social ties, networks, and communities are crucial, both in terms of family support and in terms of good social work practice. And I'm really preaching to the converted here, but this is about meeting families where they're at. I've also done some work attached to this in one of the case study sites with families, and families routinely told me that they were afraid of social workers, that they perceived social workers as middle-class people with ties and suits and name badges who came and knocked on the door and threatened to remove your children. This is not the way to build trust with families, and there are real bridges that need to be managed in this respect. Strong connections with preventative family support services are crucial, and relationships are central to this, between people. I think we talk about interagency collaboration in a way that's quite clinical, interagency working. But we get to the nub of this, really, it's about relationships. You know, when social workers talk the most positively across these case study sites about systems which enable them to get to know other professionals personally. So when social workers had good relationships with professionals that they knew personally in family support, that's where those really productive relationships and connections happened. So relationships have to be at the core of this, and services need to be designed in ways that enable those relationships to flourish and to grow. The lower rates of high-cost late intervention in Northern Ireland are worthy of much further research, and they're significant. The implications are significant. If England had rates similar to those in Northern Ireland, there would be around 1.5 billion per annum less spent on the looked after children system. So we need to really understand more about these differences across nations within the UK. But fundamentally, practice isn't enough. This is not a story about bad social work practice. You know, the structures and systems that social workers are practicing within need to put deprivation and poverty at the heart of planning and service development. We need to think about this as a systemic issue and about the ways in which systems can be redesigned to more adequately support the families that are most in need of the support. So Professor Trask concluded at the end of her talk this morning that only through systemic, family-centred approaches can we support the most vulnerable to realise their potentials. And from what I've observed in speaking to social workers, I think this would be the aspiration of most social workers already. But it's not always the reality. And I hope that some of what we've been able to observe through the case studies helps us to think through some of the barriers why that might not be the case. We want to reframe child welfare inequalities, or child welfare, as a matter of inequality. We want to take an established inequalities lens, which we already know well, in terms of education, in terms of health. We want to think about child welfare within that context. And I've just finished reading John Carnagan's book about the Violence Reduction Unit, and in that book he talks about a coalition of the willing. To do this work, I think we need a coalition of the willing. And I think we are that. Right? We're all here for a purpose, but we're also very good at preaching to the converted. So we need to get better at convincing people who aren't of our mindset necessarily about the importance of these data. And I think to do that we need to be brave and disruptive in our thinking and in our actions. So if this floats your boat, if this is of interest to you, I want to challenge you to do one thing before wine. And that's to write down one action that you could take within your practice, whether that's as a researcher, a support worker, a practitioner, that you could do to connect with or begin to challenge or address child welfare inequalities. Thank you.